Hi, welcome to Cardiac MRI Simplified at mricardiac.com. I am Dr. Bhavin Jankaria. Um, my turn was last week, the first week of the first Thursday of the month, but I couldn't do it, so here I am. And while this is a cardiac MRI site, I saw a case recently that made me thinking about myocardial calcification. This 45 years old came for a CT scan for an abdominal complaint, and her CT scan chest showed this. But actually, a PET CT had been done prior to that, a CT chest, and everybody had missed it because I think it just doesn't, or rather, it's so off track, it's so unusual that it just didn't hit anybody's minds. And you can see here that there's diffuse calcification of the myocardium. And you would have expected that this patient would have cardiac problems, etc., but the echo was absolutely normal. On further questioning, the patient mentioned that they had a near-death event a few years ago with multi-organ failure, but then miraculously recovered. So I started looking because I didn't really, this is the first time I've seen or noticed diffuse myocardial calcification. And there's this lovely pictorial essay in Journal of Cardiovascular Computed Tomography uh, that talks about myocardial calcification and then all the mimics, etc. And there's a whole lot. So sepsis, of course, comes here, but you have this whole dystrophic calcification list that comes in here. And our patient likely had sepsis-related dystrophic calcification, but with no other adverse damage. I'm assuming if we do an MR, we may see some fibrosis or raised T1, or maybe reduced T1 because there's calcification. But there is no reason to do an MR because the patient doesn't really need one. But there are other myocardial calcification. So aneurysms for one. Here's an LV apical aneurysm with an old infarct that is calcified here, along with the fibrofatty change. You can also see the coronary calcification here. And this is another apical aneurysm with a very tiny calcific focus. So it can be quite subtle. Again, here you can see the calcification in the RCA. And then when we have large aneurysms, blowouts, etc., their walls can calcify, and you can see a large thrombus here in this lateral wall blowout with peripheral calcification. And this case I had shown a couple of years ago, where this was this large calcified aneurysm that took quite some time to decipher because it was so big and it had been around for so many years. And here's the URL of that case. Then we have, so there's dystrophic calcification, there's metastatic calcification. Again, I've never seen one. And then we have the rest of the calcification in other parts of the heart, which is what we will quickly run through. So pericardial calcification is perhaps after coronary artery, the commonest calcification we see, especially in India, in the setting of tuberculous pericarditis. And I had shown this case as case 62 when we looked at this patient who had diffuse pericardial calcification and the heart appeared as if it had been caught in a vise. We've also discussed this other entity or calcified amorphous tumor of the mitral valve, which on echo looks like a mass. And then on MR and CT, you can pretty much make out on MR, the location is very characteristic. It is typically something that occurs in the elderly with advancing age. And on CT, it's just very, very straightforward. We see this diffuse calcified blob in usually the posterior mitral valve leaflet. When we're reading scans in the elderly, you can pretty much see varying forms of mitral valvular and aortic valvular calcification. The mitral valvular calcification can extend all the way along the annulus, and then the aortic valvular calcification is seen on these axial images. We do report them when they are significant, but if they're mild, we often don't call them. Then we have the intraluminal causes. So here's a large right atrial calcified thrombus. This patient had carcinoma breast, and this was likely related to the tip of the chemoport. That's one of the common places where we see thrombi. And this was likely unrecognized and now is there in the right atrium. On the contrast study, we see it as a filling defect, but again, on the delayed images, it is seen very well. And then intraluminally, you have tumors. So here's a myxoma, which on the CT shows high density. Now, earlier there were a couple of papers that said that if you see high density on CT, that confirms myxoma. But this is the only patient in the 10, 15 myxomas we've seen where the CT has shown any kind of high density or calcification. But that's pretty much it. And then, of course, we have coronary calcification, which is, I guess, the commonest form of calcification that we see as far as the heart is concerned. So, very short, but the idea was because of that case of diffuse myocardial dystrophic post sepsis calcification, to just run through um, an interesting thought process. I have seen endocardial calcification in the setting of endomyocardial fibrosis, but I cannot for the life of me find that case. And these are the rest, and we've already discussed them. And I guess the whole point is that if we are cognizant of this, in some situations, the presence of calcification can point us towards a specific diagnosis. That's the link to my WhatsApp channel. That's the book that started it all. That's my other book. And thank you so much for listening to me and have a great weekend.